Folks, thanks for joining us today. My name is Sean Dubas with Premier Marketing, and we'll be spending the next half hour or so discussing legislation that affects how an agent deals with higher income individuals under the auspices of the Medicare programs. So we'll be speaking of the different IRMAA detail that can affect your Medicare business and make certain that you have the details you need to properly explain and have those numbers at your fingertips in order to deliver the detail that your clients and prospects that fall in this category need to make proper choices and be aware of what programs will cost them moving forward. One of the things you'll find in today's presentation is that we do cover most of the questions that an individual has in this area. However, this is a short version, and we want to make certain that if you have questions, you put them in the question box, and we will make certain that we address them by the end of the presentation. Today's presentation is being recorded, and it will be made available to you, the recording, on our website at premiersmi.com and on our YouTube channel as well. So let's begin with a bit of level set about Premier Marketing. We're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform with offices across the country, and we're licensed in all 50 states. We act as an insurance wholesaler working with independent insurance agents such as yourself, and do so through contracts at the highest possible commission levels with recruiting contracts available to those who qualify. That is handled through a full portfolio of products aimed at the Medicare market. And that includes the base Medicare programs, the Medicare Advantage, Medicare Supplement, and Part D standalone prescription drug plans, but also includes life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs and disability income plans, and ancillary benefits that include dental, vision, hearing, critical illness, cancer, hospital indemnity, accident, and telehealth programs. Keep in mind today's presentation is centered upon that opening salvo, those Medicare programs, and how it affects Medicare Advantage, Medicare Supplement, and Part D prescription drug programs. When we look at the Medicare market, we see a huge opportunity for agents to aid this population. In many cases, they are well informed. In other cases, they are particularly vulnerable and really need solid counsel. That's the purpose of today's presentation. Because when you look at Medicare, and the details of the population, you don't come on a presentation like today without hearing of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. That is based just on age. And we need to keep in mind that some folks that are eligible for Medicare benefits will defer some of the access to those benefits for one reason or another. It may be because the pandemic has affected their retirement. It may be some of the folks at the tail end of the baby boomer generation that need to work a little longer or at least delay accessing Social Security benefits to receive the maximum amount that's available to them. Whatever the purpose is in that area, when based on age, that detraction from that overall number, well, it's more than made up by the folks that are under the age of 65 and are accessing Medicare benefits because of a disability. So we have a huge market that has choices, and those choices are affected by premiums and, in certain cases, extra premiums that come about. Because if you look at Medicare folks, well, they can decline the optional Part B should they choose to do so. Most don't. Some will self-insure for the shortfall and the medical benefits and pick up a Part D plan to help with the prescription expenses. Some will add a standardized, modernized Medicare supplement and then add the Part D programs to cover the medication cost. And these are folks that you will see particularly affected by the IRMAA legislation. And you have a number of individuals that are opting into the Part C programs, the Medicare Advantage plans that bundle all the benefits together. In each of these circumstances, individuals of higher income can be affected by this legislation and can significantly affect the cost of participating in different types of coverages. And we're seeing on different data delivered to us by organizations that tell us that it's a fairly even split when it comes to some of the choices between Medicare Advantage and Medicare supplement plans. Some of it's been altered by the pandemic, and those numbers are changing a little bit. However, in each of these circumstances, IRMAA can affect the cost of participation in different programs. And so we want to be able to deliver information to people in the manner in which they can best accept it. And when you're dealing with a higher income individual, an assumption is, well, they may be more computer savvy or are more comfortable in receiving information in that fashion as well. So we have to have programs that can deliver the information and be able to pivot between a face-to-face type of presentation across the kitchen table, like many of us have been accustomed to through the years, or a face-to-face through Zoom or another sort of electronic means in a virtual circumstance, and make certain that we can deliver the information they need along with detail as to how this legislation can affect their different choices. Because, well, the population's been trained over the course of the pandemic to receive information in this fashion. And it's brought about by, well, gee, accessing care. Many of the visits through the pandemic have been on a virtual basis, and that's going to continue into the future. It's part of the new normal. Will it be to the same extent as it has been in the past? Perhaps not, but it goes beyond primary care and specialists. You're seeing hospitals that are doing a lot of the prep work virtually. Dentists are even doing it in that fashion. And then, of course, many of the things that we do as part of our life on a regular basis, worshiping through our faith-based families, that is an online presence in many circumstances as well. So we want to talk about the IRMAA detail that can affect your Medicare business. And we got to keep in mind that this was legislation that was first enacted in 2003 as a provision of the Medicare Modernization Act, and it applied only to high-income enrollees of Medicare Part B. In 2011, it was expanded under the Affordable Care Act to include high-income enrollees of Medicare Part D as well. We've seen some changes here since last year and how some of the prices have increased, and we had a historic increase in the Part B premium, and that's for the general Medicare population. We can see where these coverages are even a bigger dog pile when we deal with high income individuals. And these changes were explained by different factors that drove up the price of these programs for everyone that came into play was the Alzheimer's drug Aduhelm, and I mispronounced it. I apologize, but it was a very expensive, is a very expensive medication, and drove up coverages for everyone overall. There's been some different pieces that come about as to how Medicare is going to cover this in the future, so it's going to affect, well, premiums not only this year but in the near future as well. When we look at how these extra costs have affected a person's Part B monthly premium based on their income, it is a adjustment that amounts to about 7% of the people with Medicare Part B. So you have this affecting the individuals that are of higher income, much higher income than the standard Medicare beneficiary. We look at some of the numbers on the median income for the Medicare population, it's about 26.2. They're not affected by this to any extent. However, that 7%, well, gee, once you get above 91,000 and going to 114, you see that monthly premium jump 68 bucks. For the folks in the next income strata, it goes up significantly, even more, 170 and a dime. higher still when you get into some of the other incomes that come into play. So it can make a huge difference for some of these people. Now, keep in mind that even for the folks that are at $500,000 and above, $408 for Part B premium, let's face it, if they were to find coverages in that near Medicare eligibility strata, they couldn't find programs that would cover them nearly as well as Medicare on a general basis. So these are some extra dollars that are taken from them. However, it is still a solid value for the Medicare beneficiary, even in the highest spectrum of income. When you look at how it handles for a couple as well, you can see how that can really affect those individuals with some different numbers that come into play. Fewer categories, big jumps. When you look at how this legislation also affects the Part D coverages, you'll see that this affects about 8% of the population on Medicare and can really bump up these premiums as well. So in addition to the regular plan premium that a person has to satisfy for the medication coverage, when you get into the higher spectrum, you see some surcharges that can affect just that portion of their coverage as well. We talked about earlier in this the different choices that an individual has. So if you have a beneficiary that's going to select a Medicare Advantage plan with prescription drug coverage, the MAPD programs, Medicare Advantage prescription drug plans, if they fall in these categories, it'll affect coverages there as well. So we need to be aware of the fact that regardless of the choices that come about, the higher income individuals are going to pay extra. Same thing once again applies to couples and how it can affect both of their coverages. Because keep in mind, it's an individual choice. It's not a hubby wife type of thing together in one program. They're both affected by their individual choices by the household income. So what we want to do is make certain that you have these numbers and are aware of the differences that they can make for the beneficiaries you have that you work with in this area. And we deliver upon this information because we want your business. We want to do it without a surcharge to you as an agent working with us. And so this is something that you can take these guides. You can utilize the CMS website if you're doing some things virtually to make certain that the population you're engaging at the time understand where these numbers are coming from and put it as part of your presentation. Now, keep in mind, the detail that we saw earlier is it affects 7 or 8% of the Medicare population. So it's not the average Medicare beneficiary that you'll be dealing with to incorporate this information into your own personal marketing plan. But if you're dealing with the high income individual in the Medicare strata, we want to make certain that you have this detail and put it as part of your program. If you're doing things electronically, obviously you have access to this information on the internet from the government sources, straight from the horse's mouth. And you can utilize it to impress upon the folks that you're visiting for counsel on the different choices that they have as to how these things are going to affect their cost. Now, we haven't spoken about anything about appealing some of these numbers that come into play, but that's another short piece that we'll be doing in the future. So all that said and done, we want to make certain that we can deliver to you this information and make certain that we thank you for the time that you've spent listening to us with some of the detail that you'll need to properly address this segment of the Medicare population. Checking quickly for questions since this was a very short presentation. Nope, we have it all here. The one question about the appeal, as I mentioned before, we'll be doing in a different presentation. So all that said and done, until we have an opportunity to speak with you again in the near future, I want to thank you for spending time with us, and we look forward to visiting with you in the very near future. Thanks a lot. And until we're able to speak again, I wish you good selling. Thanks so much. Talk to you soon.